Okay, thanks to MSNBC for this story. This was live, so I'm just going to play it for you guys real quick. Now, I have been noticing lately that after seeing Dr. Fauci talk, that well, I would suggest you watch what he's saying about the vaccine. Basically, they're saying that it will should definitely keep you from getting sick if you do catch the virus. So I'm not a medical professional, so so I think you should listen to them. But I want y'all to see this, and this guy talk about some friction. Listen to his friction, okay? Okay.
Dr. Vin Gupta, critical care pulmonologist out of Seattle who specializes in exactly this. He's also on the faculty of the University of Washington Institute for Health Metrics and Evaluation. Well, Doc, you heard the voices of those Americans in the state of Mississippi. We all have to live together in this one country we've been given. What do we do about what we just heard?
Well, Brian, I think there's two things up front. Number one, and good evening, by the way. Number one, I think there's just confusion on what these vaccines do extremely well, regardless of the variant, and essentially everywhere in the world.
And this is what I was talking about. I can agree with this because now it seems like they're saying something that I never heard them say before. And if it's true, it's true. I just wish they would have said it when they first introduced the vaccines. I think they would have made it more clear. But that's one thing. But forget that. I mean, don't forget that. That's important. Look into that. Look into that. Research that, please. But listen to what he talks about, this friction.
And will keep you out of intensive care. That is the critical piece here that we've lost when we've communicated about vaccine effectiveness. We delve too much into vaccine effectiveness percentages and numbers that are confusing to people. They're frankly confusing to me.
They're the ones that didn't tell us this stuff.
Whether you're talking about J&J or AstraZeneca or Pfizer or Moderna, they all are 100% effective in those who receive them in keeping those individuals out of the hospital and out of intensive care and avoiding deaths. That's all that matters. Number two, I would say to your...
I didn't know none of them were 100% effective. Is that true? I thought they were on the 90% percentages, but I'm not sure. I'm not a scientist.
Your point, and from Allison's reporting there, if that doesn't reach people, how do you reach those people? And that's where I think we need to introduce some friction into the system. Once vaccines are broadly available, Brian, we need to take a page out of what other countries are doing to some degree and say, you know what? The vaccine is available. It's safe. It's very effective. If you're not going to get it and you want to go on a flight or you want to go out to dine or you want to go out to the ballpark.
Or you want to be free?
Show us a negative COVID-19 test and you're going to have to mask. We're going to have to introduce some friction here premised on some degree of personal responsibility at that point. Otherwise, we're not going to reach where we need to reach, which is herd immunity. Hopefully 75 to 80% of the country is going to be willing to accept the vaccine. But if we don't get there, we're in a really tenuous balance.
All goes back to the pictures of Elvis getting the Salk vaccine. We had the head of the ad council on this broadcast talking about their campaign. I think that point you just mentioned is when they have to be on the air with a killer public service campaign along those same lines. Couldn't agree more. Dr. Gupta has agreed to stay with us just during this break. When we come back, he'll explain why he says our path to normalcy, and that's the goal, remember, is tenuous, may look at times a bit more like a minefield.
Our path to normalcy, our path to freedom.